Knock, knock. Hi, Caroline. How are you?
I'm good. And yourself?
All good, thank you. I am Camilo Claver. I am the treating physiotherapist today. How are you today?
Not too bad.
You feeling good?
Yeah.
That's great. Before we go ahead, may I double check some information with you, please? Can you please tell me your full name, date of birth, age, and yeah?
Yeah, my name is Carl Krisner. I'm 55 years old. My date of birth is 17th of May of 1990, whatever.
All right. And your age, you told me?
55.
55.
Yeah.
All right. How are you feeling now?
Pretty good.
Are you okay?
Yeah.
That's great. Yeah. Do you know what the physiotherapy is?
Yeah, they came yesterday, but I was too tired, so we couldn't.
All right. I know you've been walking with them like 10 meters, and you couldn't make it a little bit longer because it was a little bit fatigued. Is it?
Yeah.
All right. All right. No worries. The session today is going to look like pretty much the same as yesterday. We will have a sort of subjective information, gathering some information from you to get to know better in order to help you a little bit better during your stay in the hospital. Then we are going to do some hands-on assessment, and we will plan some goals that are in line with what are you expecting of your stay in this hospital. And then we will do some exercises. Is that something that sounds good to you?
Yeah, thank you.
All right, no worries. First of all, I would like to start doing some questions. Do you have any medical condition?
Well, yes, I've been with the cancer like for the last 5 years.
5 years?
And now I have this surgery, like hopefully it's all good now.
Okay, okay. Do you have any other medical conditions? I don't know, high blood pressure, diabetes?
No.
Nothing that you're aware of?
No.
Are you taking any medications now?
Yes, for the pain.
All right, what are you taking?
Tramadol.
All right, so tramadol, are you taking
Oral.
Oral? All right, and usually now it's 11 a.m. So at what time did you take your tramadol?
Around 30 minutes ago.
30 minutes ago.
So
just pain-wise, your pain in rest, how is your pain in rest? How would you describe your pain in rest?
At the moment, because I took the medication, it's like between 2 and 3.
All right, and before the medications, if you can put a score on your pain between 0, which is nothing of pain, and 10, which is the maximum pain that you could ever imagine, how would you rate your pain before taking this tramadol?
Oh, it was very bad, like 7 or 8.
All right,
Yeah.
so now 30 minutes after your tramadol, how is your pain while there is no movement?
It's not bad, like 2 or 3.
2 to 3, which
Yeah.
is great.
Yeah.
And when you are moving, how much does this pain rises? Does it rises any?
Yeah, I'm trying to don't move because
You don't move anymore.
Because I know
It
it could
is
be
painful.
painful. So
All right, so just to double check, your pain now is 2, 3 out of 10. Is that correct?
correct.
Is it localized in your right chest?
It's just like here in the surgery, like my scar.
All right. Does it go anywhere, that pain?
Not really.
All right. When you deep breathe, is it increasing?
I don't want to try to.
All right. Have you been coughing?
No.
Not much?
No.
All right. I know from your notes, sorry, I'm going to go back and forth, just making a few questions. While you tell me these answers, I will be asking questions over your answers. Is that all right for you?
Yeah.
All right, cool. I know from your notes that you live in a double-story house.
Yes.
Your second floor is, your bedroom is in the second floor, and you live with your husband and 2 girls. Is that correct?
Yeah.
Your daughters, how old are they?
They're 17 and 21.
17
Yes.
and 21. So
Yeah.
they are older, they don't need mom to take care of them. They can take care by themselves. Is
Yeah.
that correct?
Yeah.
All right. And your husband, is he able to help you out in, things that needs to be done at home?
Yeah, he's very supportive, but he have to work. So
Has to work.
especially now because I cannot work.
He's a full-time worker.
Someone need to pay the bills,
All right. That's
Yeah.
fine. That's fine. I know. I know also that you work as a principal in a school.
Yeah.
You miss going there?
Absolutely.
Absolutely.
With my kids.
Yes, I know. I know how principals are. I know that schools are like that, and that's fine. I know that also you're on a long leave service now.
Yeah.
Yeah.
Mm.
And you are okay with that?
Well, like, yeah, at the moment I'm so weak, I get tired very easily, so I'm trying to like don't think about that, but like I would love to come back eventually there. Like, if you ask me like how long, probably the next 6 months, within a
Okay.
year maybe. If we're going well, hopefully 6 months will be ideal.
All right. Are you having I don't know. Let me try to uh, ask it this in the right way. Are you having any troubles to pay your bills, or think you need to have any sort of support on that matter?
Well, like, yeah, like I mean, we used to work 2 of us, like
Yeah.
now.
I know you're in a long leave.
Exactly.
Yeah.
So, but yeah, it's not too bad. We're not too bad.
Do you think you have all the resources to go through that, or maybe that the hospital and the health team can give you a sort of a hand with that? Maybe put you in contact with the social service to have any sort of available resource in order to help you out?
Well, I never thought about that, but yeah,
Alright.
it would be great to have.
Okay, that's fine. I also want to know, what are your hobbies? I know that you love running,
Yeah.
and yeah, that's something probably that you want to come back to.
I would love, but like now, I don't know. Like it feels like it could never happen because I'm so tired.
Yeah, 100%. Do you have any other hobbies?
Yeah, like something more like quiet, like stay like in doing like some crochet.
Knitting?
Yeah.
Knitting
crochet,
stuff.
knitting.
All right, fair enough.
Yeah, like active stuff now because I've been reading a lot how exercise helps. But like I am so scared with this.
I know, it must be really scary, but we are going through that. No worries. Next questions. Do you smoke?
No anymore.
Not anymore. How long did that you stop smoking?
Maybe when they told me about the cancer, I stopped it.
So that was maybe 10 years? Sorry,
Like 5 years.
5 years ago?
5 years ago. Yeah, it was very hard, but I was scared about this.
And do you think at the same time, do you think you have all the resources to go through that? And I mean, coping with the stopping of smoking? Are you doing well on that end, on that matter?
Sometimes it's hard because like it used to be part of my life.
Yeah.
Like every break, smoke goal, like
Yeah, and now it's gone.
Yeah.
That's fine.
But yeah, I'm going good.
You're doing well with
Yeah,
that?
I think so.
All right, fair enough. And do you drink alcohol?
Just sometimes on the weekend before like surgery, I used to like have a sort of active social life, not too much, but like
All right.
every now and then.
You know that in terms of alcohol intake, we should keep like below 8 to 10 drinks per week. Is that
Okay.
something that you are doing?
Yeah, yes.
All right, fair enough. Anyway, if there is any concerns on that, there is also plenty of resources to give you a hand if you ever think that you need a hand with that. Yeah, obviously the health team is gonna be there for you. All right?
All right.
Cool. I think that I don't have more questions to ask you now. I know that your pain is settled down, and that's something that we need to address early in our session in order to get you better moving. All right? From the notes I got that there is a little bit of swelling on your right arm.
Yes.
Yeah, on your right arm, and probably it is painful because obviously you had a surgery. There is a node resection there. You know what the nodes are?
Yeah, like sort of like collect the liquid.
There is a little pipes that are around all our body, and those are collecting all the products that our body doesn't want.
Yeah.
But when they are resected, all those products and all this inflammation and all these liquids that usually are going away over this, the lymphatic system, it's getting a little bit of stuck there. which is something that we are expecting after the surgery and after the no dissection. But we don't want that this go increasing in the time, and there is something called lymphedema that we want to avoid. And the best way to avoid it is moving. And if you move it, and you are without pain, and you move it better, then the lymphedema shouldn't be there. All right?
Yeah.
That is one thing. The second thing that we want to avoid is the post-op pulmonary complications. That means that when you underwent surgery and you were under anesthesia or general anesthesia, your lungs started to breathe a little bit less. So what we want to avoid is that this surgery takes you to any sort of infection, any sort of, what it's called like a post-op pulmonary complication. And the best way to do that is keep you moving and keep your lungs clear of secretions, keep you breathing better. All right? I know that your thorax is painful to move.
Yeah.
I know that you are scared, but at the same time I want to show you something that it's going to improve the way that you cough. It's going to be less painful, and maybe it's going to help you with the way that you cough, so it's going to make you like a little bit more confident. And if you find something that is in your chest or in your throat and you want to split it out, just let me know. All right? I'm going to show you. Let's pretend that this is a towel, a big towel, or you can do it with a cushion. Just lift your right arm a little bit, and you're going to do like a sort of a splint with your arm. With your other arm, you're going to splint your thorax.
I'm scared to like press the scar.
I know. Do you mind if I sit it here?
No, go for it.
All right. So we're not going to do that now. I'm just going to show you the way. So you're going to split with your arms, and each time that you want to have a good cough, your arm is going to press against this.
You want me to do
You know what I mean? Not yet, because I need to have a look to your scar and have a proper look to your thorax. But that's something that we will work later on. But it's just something that I want you keep in mind. All right?
Yeah.
Let me take that off. All right. I've got my tape measure here, and I just want to make sure how long is this. Sorry, what is the measure of this thing? The circumference, which I see it's 37. All right, and let's see in the other arm, it's 41. So there is a slight increase in the circumference there, which is something that we can expect. And also I want to compare the left wrist, which is 25, and here is 28. All right, so there is a little increase in that. And as I told you before, the best way to keep all your edema from your right arm away is to keep it moving. All right? All right. I'm gonna take my my thing to take the vital signs.
Mm-hmm.
So I'm gonna put to take your arterial pressure, and at the same time I would like to know how is your SpO2. All right? All right. I can see your SpO2 is 97 on room air, which is great. It's something great. There is nothing happening on your lungs, and your arterial pressure is 130/80, which is beautiful. Your vital signs, your cardiac frequency, it's 98, which is also a little bit on the higher end, but it's something that we can expect. Obviously, when somebody is a little bit scared or there is some pain, the cardiac frequency is a little bit high. I forgot the name. Doesn't matter.
Heart rate.
Heart rate is a little bit high. All right, but that's something that we can expect. All right. Next thing that I want to do is just have a look to your thorax. If you don't mind, I will have a look and I will count how many times are you breathing per minute. So take it easy and just breathe, relax. All right. All right, that was like 25, 27 breath per minute, which is something a little bit high, but I know that you are breathing like a little bit of superficial. You are not taking deep breaths because probably you're scared and probably it's painful.
Yeah.
Yeah? So let me just have a look to your breath sounds. Do you mind if I put my stethoscope on your skin? I will have to go under your skin, your shirt. Is that all right for you?
Yeah,
All right.
correct.
Now, I know that this is painful, but try to take a deep breath. All right, I'm gonna go under your shirt. Is that okay for you?
Yeah.
Breathe deep breath. Again. All right. Deep breath. Very clear breath sounds. All right. Can you lean forward a little bit? Cool. Good job. Gonna lift your shirt. Deep breath. One more time. One more time, please. One more time. One more time. One more time. One more time. All right. Breath sounds are clear, a little bit low, you know, because you are not taking too much air, but that's something that we can address now. All right. I will want to have a look to your incision side. You don't mind if I leave your shirt?
Mm-hmm.
All right. From what I can see, it is healing well. There is no drainage. Your dressings are dry. There is no traces of blood, which is good, and there is no signs of infection. It's not, you know, it's not warm, which is good. Yeah, so good. I know that you are after surgery, so I just want to double check a little bit of red flags that, you know, will need a little bit of further investigations. Have you had any weakness in any side of your body?
No.
No? Any loss of sensation, any alteration of the sensation, I don't know, in any place of your body?
Not really, like this arm is just like huge, but like not really, like I can feel it.
Fever, chills,
No.
night sweats?
No.
No. Any problem with your bowel or bladder? Like a sort of incontinence?
No.
No. Pain in the back of your calf or your knees?
No, I haven't
No?
moved much, so.
You haven't moved it much. Do you mind if I have a look?
Yeah, go for it.
All right. Let me have a look. Not painful.
Ticklish.
Ticklish. But not painful.
Not the same.
All right, because I'm compressing, so if there is any problem there, you will notice like a sort of a pain there.
Yeah.
But there is nothing. Can you wiggle your toes? Cool. All right. I'm gonna just remove this. Can you bend your knees for me, please? The other one. Cool. Straighten legs. Straighten the legs. Now, move your knee up. Don't let me push you down. Just the knee. Bend the knee. Yeah. Again. One more time. Push, 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 push. All right. This is the right one. Push, 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 push. Straight. Push, 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 push. Cool. Now that we are here, can you please straighten your knee, please, for me? One. Now, don't let me push you down. Don't let me push you down. Great. The other one. Up. And don't let me push you down. Don't let me push you down. Great. Good job, Nadia. Caroline. Good job. Good job. This one. Good job. Good job. One more time. One more time. Beautiful. Now, don't let me push you that way. Push, push, push. Release. One more time. Beautiful. Can you please bend your knees there and just lift a little bit the buttocks from the bumps from the plank. Good job. One more time.
It's a bit painful here.
It is painful.
A little bit.
Yep. Let's put in practice what I have teach you. So, raise your arm a little bit. Yep. Spleen, spleen, and lift your buttocks from there. And lift. Beautiful. Is it painful? A little bit less painful?
It's better, feels
It's
better.
better. All right. So we're going to stand up now, and we're going to go for a walk. Is that all right for you?
I think so.
I think so. All right. Put your feet there. Roll this way. And there. All right. Look straight. Straighten your back. Try to take a deep breath. Dizzy.
No, I'm alright.
Are you all right?
Yeah.
All right. Your color looks good. Pulse are strong. Great.
Mm-hmm.
Can you lift your left arm that way? All right. And with your right arm, we are going to do the same, but just 90 degrees.
There?
Beautiful. And straight. Back. One more time.
Oh, this is scary.
Beautiful. I know this is scary. It would be scary too. But you're doing a good job.
Is this all good with it?
It's all good.
With
There is
the
no
scar,
problem
if I
with the
move
scar.
it?
There is no problem as long as you're not feeling like a sharp pain there.
Yeah.
I mean, the stretch is going to be painful,
Yeah.
but we need to keep in mind to don't feel like a sharp pain, like too much pain. Your pain will guide you.
Yeah.
Just maybe a 3 or 4, that's fine.
Can I go further?
Just leave it there for the moment until your scar is healed completely, so we are not, going over there.
Oh, I cannot do this.
Not at the moment.
Okay.
Yep.
Yeah. Good to know.
All right. Now that we are there, I want to know if you are dizzy, feeling dizzy.
I'm feeling good.
All right. I'm just gonna put your shoes here, 1 and 2 shoes, and I'm gonna ask you to stand up if you want to keep dizzy. There, it's fine. All right. 1, rocking back and forth. 1, 2, 3. Good job. How are you feeling there?
Not bad.
Big drink, big big deep breath.
Yeah.
All right.
Nice.
Pulses are nice. Your color is good. You look great. Beautiful. How are you feeling?
Good. Nice to see the room.
Do you think any sort of breathlessness?
A little bit.
A little bit. If you can score this breathlessness, your 0 is no breathlessness at all, and 10 is you cannot give one more step. How would you rate your breathlessness now at this moment?
Like 4 maybe.
4?
Mm-hmm.
Mm-hmm. All right, fair enough. Can you do some marches for me, please? All right. Nice and straight, and doing some marches on the spot. Can you do 10 marches for me? 4, 6, 8, 9, 10. Good. Good job, Caroline. How are you feeling now?
Good.
Are you okay? I just want to double check with my SpO2 that you are doing all well. Your heart rate is not too high, and your respiratory rate is not too high, which is great. Okay, great. You are not using any device. There is no lines from what I can see. So, and you're not using any oxygen, so it's fair and it's safe for us to go for a walk. All right, your feet are okay. You are fitted with shoes, so let's go for a walk. What I want from today is walk at least 10 meters.
Yeah.
All right, and if you feel like you're short of breath or you need to stop, just let me know. All right?
Okay.
Let's go for a walk. Good job, Caroline Krisner. How are you feeling that?
Good.
Right? Alrighty. Alright, those were 10 meters. How would you rate your breathlessness?
Not bad.
Not bad means what number?
5.
5?
Yeah.
Alright. Do you think you can keep going for a couple of meters more? Or you really feel like you need to stop?
We'll let's take a quick breath.
Alright. Alright. Let's go this way. Alright.
This way?
You can stay there. But I want you to stay in this chair, please.
You want me to move there?
Yep.
Into one.
Yep. Beautiful. Alright, Nadia. Since you are there, I just want to show you a couple of breathing exercises. First thing first, when you are feeling breathlessness, you are doing some exercises when you're going to do something that is called pursed lips. And what does it mean? It means that you need to just close enough your lips so there goes with a little bit of pressure.
Alright.
Let me show you. Let's pretend that you are trying to blow a sheet like that.
Alright.
Or you're blowing candles.
Alright, yeah.
But we are going to do it nice and long. Alright? So let me show you. Could be like that, or could be
Alright. Practice. Next month is my birthday, so I would like to practice that.
Cool. Are you going to invite us to the party?
Absolutely. You've been part of my life now.
I'm pretty sure. Good. All right, I can see that you are not taking deep breaths. So what I want you to do, I know that it's painful, I know that it's not going to be easy, but try to keep this splintered and try to take a deep breath as far as you can. All right? So each time that you feel like you are short of breath, do this pursed lip. Alright? If you feel like you need to split your upper arms, you can also put your arms there, and that's going to help you a little bit with your shortness of breath. Okay? Next exercise we're going to do is called thoracic expansion exercises. And that's going to do like bring air into your lungs and avoid any complications, basically, on your right side. Alright?
Okay.
So, it is going to be a little bit painful, that's fair. We don't want sharp pains, we don't want any exacerbate pain, just bearable pain. Alright? So, what are we gonna do is this. Take a nice deep breath. Hold 1, 2, 3. Breathe out. Good job. Good job, Caroline. One more time, please. 1, 2, 3. Breathe out. Good job. We're going to do this 4 times. This is the second one. One more time. Probably you will feel a little bit dizzy with this thing. This is what bringing a lot of oxygen into your brain, into your body. And one more time. Cool. Now, nice breathe. Just relax and breathe. All right, if you want to lay back, that's fine. Have a rest. Feeling better?
Yes, good.
How would you rate your breathlessness or your shortness of breath?
Like now it reduced a lot. It was like
How would you score it?
2, 1.
1 over 10?
Yes.
All right, let me just quickly put this thing on your finger. I can see you're on an SpO2 of 98, which is great, and heart rate is 100%.
Yeah.
100 per minute, 100 per minute, which is great. It's something that we can expect. I know that I can see that your breathing pattern is much better. And we're going to do another walk, 10-meter walk, all right? Walking is the key for success. So probably I will ask and talk with the nurse. She will gonna come to you and make you, run like 1,000 meters. No, I'm just kidding. Just walk around the board, probably, walk as much as you can,
Yeah.
during the day, all right?
Okay.
Cool, let's go for another walk. All right, how are you feeling there, Caroline?
Good.
30 minutes, or 40, I don't know how much is it. Nice deep breaths. You're almost running, Caroline.
Yeah, it feels
Yeah,
good.
I need to keep up with your pace. You're doing great.
I can't believe that I'm doing this.
Wow, you're such an amazing job, Caroline. Doing an amazing job. How is the pain going? Now that you're walking, how's your pain?
Same. 2,
Oh, great.
2, 3.
That's so good.
Yeah.
And what about the shortness of breath?
I'm trying to breathe a bit like you teach me.
Yeah, remember, poor sleeps when you're tired. I think we're doing over, like, I don't know, 30 meters, which is great.
Yeah.
How is your
Can I
shortness of breath?
Good. Can I go to the toilet by myself?
Just wait me for a second.
Yeah.
Let's sit over here and we'll come discuss that later.
Yeah.
All right. I didn't see any problem with your walking. I know yesterday was a little bit of fatigue, but I couldn't see anything like that today. Anyway, this is my first time with you, so I will feel better if you call to the nurse and she is with you the first day or 2 days. All right?
Yeah.
You definitely can go by yourself, but under the supervision of the nurse. So each time that you want to go to the toilet, you won't need any wheelchair. Just call, they will come to you and they will see actually that you are safely going. There's no lines, there's nothing in the floor, Take all the safety precautions so you can go safely to the toilet or the bathroom.
Yeah.
All right?
Yeah, all right.
I don't see any problems you walking by yourself, but definitely you will need a supervision. And we can obviously discuss this tomorrow.
Yeah.
All right?
Do I have any drain?
You don't have any drains.
Okay.
You don't have any drains on your right chest,
Yeah.
which is great. Now I want to show you some stuff that we are going to do to avoid this lymphedema that I talked to you before. You remember?
Yeah.
All right. So, first thing that we are going to do, let me show you, can you lift your elbow a little bit? So, what you're going to do is try to keep your entire arm a little bit high, not resting on the side of your body. You know what I mean? So probably we will need a little bit more of, I don't know, another pillow. Let's use maybe this pillow that you're using here. Let's pretend this is a smaller one. This is not big enough. Or yeah, maybe with this pillow we can do something like that. All right. So in this position, I'm going to show you 4 exercises that we are going to do. First thing that we are going to do is called hand squeezes. All right, you're going to do this 10 times. All right, count to 10, and then you're going to do the same with your wrist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Same thing with your elbow. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You know, we're going to do just 5 more of them because I want you to go straight and flex. Straight the elbow and flex. 1, just 5 of them. 2, 3, 4, and 5. And then we're going to do shoulder roundings or shoulder shrugs. Yep, this is gonna be like that. 1, 2, 3, 4. 10 of them. Yeah, 7, 8, 9, 10. Good job. Do you remember those exercises? I'm going to write them down for you, and I want you to do them like at least 3 to 4 times a day.
Yeah.
Same as walking. So what are we gonna do is you're gonna go for a walk, you're gonna rest in your chair, and then you're going to do your hand squeezes, wrist extension and flexion, elbow flexion and extension, and shoulder rocks. And if you feel like you need a little bit of movement on your cervical spine, you can do some stretches there and some stretches there. Keep in mind that your arm, upper arm, shouldn't go past the 90 degrees. You know what I mean? Because we don't want to overstretch here. Not yet.
Okay.
All right?
Yeah.
All right. As you already have a little bit of rest, so I just want to make sure there is nothing in your chest. And for that, I'm going to ask you to do some new thoracic expansion exercises. We're going to do them again. All right?
Yeah.
So can you please do 5 of them? Remember, first lips to go up. Beautiful. Good?
Yeah.
All right. Now we're going to add one more, which is called halving. And it's called halving because what you are going to do is like a sort of a half. Try to do this as I am doing. Open mouth, open throat. It is painful, I know. Let me just help you with the splinting thing. Put your upper arm there, splint, and do the same. Nice deep breath, splint.
Cough.
This is called half. And then come the calf. We're going to do the half 3 times. Trying to make it long, nice and long. All right, and then I know this is going to be like the most painful thing. It's going to be 1 calf or 2 calf. Try to calf, splint really hard there, and try to cough.
After, before?
During the calf. Like take deep breath and keep that splint. Cool. All right. Nothing is coming out, which is good, but at least I am sure that if anything comes up, you already know how to do it. Each time that you feel you want to cough or you need to clear your throat, use the splinting technique because it's going to give you more confidence and it's going to reduce your pain.
Yeah. Okay.
All right? Yeah? Cool. Do you have any questions for me today?
Not really.
Not really? You want us to
How
summarize?
many times do I have to do?
All right, let's going to summarize. In the meantime, I'm going to take your arterial blood pressure, heart rate with your SpO2, and I want to know how is your level of pain now, now that you're resting.
Yeah, 1, 2.
1 to 2. All right. Are you feeling more confident now?
Yeah, definitely yes.
Definitely yes.
Yeah.
All right. I know that your posture is a little bit better. We already walk like 30 meters, which is great for today. We will probably come later afternoon or midday, and yeah, we definitely will going to do another walk. Try to, you know, keep you walking as much as you can. If you can walk with a nurse, that's fine.
Yeah.
You know what I mean?
Yeah,
So-
my friends are coming later. Can I show them that I'm walking?
You can show them, but each time that you're going to stand up from your bed, ring the nurse, and then they can come to
Oh, yeah.
have a sort of supervision. You know,
Alright.
because we cannot rely on your friends to you know, with the safety precautions. We cannot rely on them. It's not their responsibility. It's our responsibility.
Oh, yeah.
You know, as professionals.
Yeah, makes sense.
You know what I mean?
Yeah.
So this is gonna be like that a couple of days until we feel safe, all of us feel safe and feels, you know, confident to see you walking around with no fatigue, no pain, and that's gonna be like you walking by yourself.
Yeah.
All right?
Sounds good.
Sounds good to you?
Yeah.
All right, so let's summarize. Walk as much as you can. Keep doing your breathing exercises, and that means thoracic expansion exercises.
Yeah.
Huffing,
Yeah.
and then cough.
Yeah.
Each time that you are moving or
Pursed lip?
huffing, the pursed lip is going to be if you're feeling like short of breath.
Oh, okay. Yeah.
You remember?
Yeah.
If you're walking or if you're doing something, just keep in mind.
If I get tired.
If you get tired, do the pursed lip because that's going to help you to take your breath back.
Okay.
All right? And yeah, so walk as much as you can. Thoracic expansion exercises 5 times. Then nice and quiet and relaxed breaths for a couple of minutes. Then when you got your breath back, you can do your huffing.
Yeah.
Yeah, 3 times of huffing, and then 1 or 2 coughs. It's gonna be enough. All right, and I want you to do that exercises, breath exercises, at least 3 times a day.
Yeah.
All right.
Great.
Walk as much as you can, and the exercises that I show you with your arm, it's something that I want you to do at least 4 times a day.
Yeah.
All right. Keep your right arm higher, and yeah, I think that's it. I'm gonna leave you here in the chair. I'm gonna let the nurse know that you are sitting in the chair, and yeah, anything that you need, just call us and let us know. All right.
Thank you so much.
Cool. See you next time.
See ya.
Bye,
Have a good
Caroline.
day.